drug check पछि नै गरौँ न फर्स्ट drug check.
Okay, so let's just go back and
Okay, so
we actually have the wrong dose before. So
no allergies, kidney, morphine, 50 mg per 50 mils, PCA. Not been given that. Okay.
so it's saying that we have
Good morning, Mariam. My name is Deepa, and I'm a student nurse looking after you today. I've just been through your notes, and doctor has ordered morphine for your pain, and
sulfate injection.
it's a PCA dose. And before I give that to you, I just need to confirm your identity. So, would you mind telling me your full name, please?
Adhikari,
Yeah, and your date of birth.
7th of 1st, 1969.
Yeah. And your MRN is 174963, 174963. And have you got any allergies, Mariam?
No.
That's good. So at the meantime, I'm just gonna check your cannula side as well. So it's not swollen, it's not red. And do you remember when it was connected to you?
Yeah, in the morning.
In the morning, so it's within 72 hours, so it's good to use. And I'm just gonna take your vital signs and record them as well. And the other thing that I'm gonna do is I'm just gonna ask you about your pain score. How would you rate your pain between 0 to 10, 10 being the worst?
8.
8? Okay, so that's a severe pain. So I'm just gonna get your medication ready, and we'll be back with your medication soon. But before that, if you need anything, just press the buzzer. Thanks. I'll be back soon. So, would you like to put the ticket order for me? So, I've got a patient named Mary Medivh, date of birth 7th of 1st, 1969, MRN 174963. And she's here because of fractured ribs, and doctor has ordered morphine 50 mg for 50 mils for her pain. And it's a PCA dose, PCA IV morphine. It's 50 mg morphine in normal saline, 50 mils. Concentration is 1 mg per mils, number of syringes is 3, PCA dose is 1, lockout interval is 5 minutes, vessel infusion is 0 mg per hour, and the hourly dose limit is 12 mg, signed by the doctor, signed and printed by the doctor, and it has not been given yet. Would you agree with that?
Yeah.
Thank you so much. Now I'm just going to gather my equipment, and then I'll be back for my first structure. Okay, thank you. Now I've gathered my equipment. Would you like to do first structure for me, please? So I've got a patient named Maria Medivh, date of birth 7th of 1st, 1969, MRN 174963, and she's here because of fractured ribs, and doctor has ordered morphine 50 mg per 50 mils for her pain relief. And it's a PCA dose, and so the concentration is 1 mg per mil, number of syringes is 3, PCA dose is 1, lockout interval is 5 minutes. Vessel infusion is 0 mg per hour, and hourly dose limit is 12 mg, signed by the doctor, and it has not been given yet.
Okay.
And at the meantime, I would like to go through the MIMS as well. So it's a morphine sulfate, it's an opioid analgesic. It's for the moderate to severe pain, and the contraindications are opioid, hypersensitivity, asthma, obstructive airway disease, and the adverse reactions are respiratory depression, circulatory depression, and GI upset. And the maximum dose is 12 mg, 5 to 20 mg per mils for the adult dose. And as a nursing intervention, we're just going to monitor the patient for every 15 minutes.
Okay.
Okay, do you agree with all those things?
Yeah.
Now I'm just gonna go to the drug cupboard so that we can get our medication. Would you like to come with me? Grab my pain. So we're just gonna take the medication out of the drug cupboard. There's our medication. Get ready. Drug book. So I'm just gonna count the medication before I use. So it's morphine sulfate injection. That's what the doctor has ordered. So morphine sulfate injection 10 mg per 2 meals and the expiry date is 10/20. Morphine sulfate 10 mg, 10 mg per 2 meals, 10 mg per 2 meals, and the expiry date is 10/20 for all of them. So I'm just gonna count them: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So there's 10 there. Then according to my calculation, we need 10 meals. So we're just gonna use 5 ampules of them. So today's date is 20 after 17 and the time is 10:06. It's for Miriam Adib and amount received is 50 mg and the balance is, we're just going to take 1, 2, 3, 4, 5 of those from the calculation. So just going to lose it like that. So the amount balance is 5. Name of prescribers is Leon Hunt. Print name of administrator, so it's my name, Deepa Adhikari. And I'm just going to sign it. So would you like, you're checking your medication?
Yeah.
Thank you so much. So I'm just going to, 1, 2, 3, 4, 5. I'm just going to leave the remaining side the drug cupboard. So we've done that. Before we go, I just want to do the final check. So it's morphine sulfate, 10 mg per 2 meals, and the expiry date is 10/20. 1, 2, 3, 4, 5. Okay, we got our medication. So we're just going to go back and get the medication ready for our patient. Before I get my medication ready, I would like you to do my second drug check for me, please. So I've got a patient named Miriam Adib, date of birth 7th of 1st 1969, MRN 174963, and she's here because of fractured ribs, and the doctor has ordered morphine 50 mg per 50 meals for her pain, and it's a PC signed and printed up by doctor. It's a PPE dose, so it's 50 mg morphine in normal saline 50 meals. I've gone through the injectable book, so we're just gonna dilute it with the 40 mils of sodium chloride. So the concentration is 1 mg per meal, number of syringes 3, PCA dose is 1, lockout interval is 5 minutes, vessel infusion is 0 mg per hour, hourly dose is 12 mg, and they signed by the doctor, and it has not been given yet. So I've got my medication with me as well. So it's, would you like to come over here?
Yeah.
So it's morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. It's 10 mg per 2 meals. Expired date is 10/20. So expired date is 10/20.
Okay.
According to my calculation, we need 10 meals of morphine sulfate. So it's 10 mg per 2 meals. So we're just gonna need 5 ampules of those.
Okay.
And we're just gonna take the 40 mils of normal saline sodium chloride from the injectable book to dilute with the morphine. So it's gonna be like 50 mils in total.
Yep.
Do you agree with that?
Yep.
Okay. Thank you so much. Now I'm just gonna get my medication ready, and then I'll need you for my third check as well. Okay. Now I'm just gonna get my medication ready.
Mills, that's signed by the doctor, is not even given. We have all the details by lockouts and such. That is not being given. So morphines that I want to. Morphine. Which I did look at the drug injections and it is compatible. We have sodium chloride, sodium chloride, sodium chloride, sodium chloride. Then we have September 18th. If I work out, it'll be 10 mils, so that is morphine. 10 mils. And then we have a 40 mils of sodium chloride. So now I'll just add those. Before I do that, I'm going to go back to this one. So that is 50 minutes. So let's just attach the line.
That's my sodium chloride.
Before I put it in, I will run over. The old clips off. I will just add the details onto the end of the So we have just on the surface line. So we have Miriam the Div. Miriam the Div. Nine, 174,963. Okay, so 745. So we have morphine. And we have 50 milligrams in 50 mils. And she can push her in. And then
Okay.
sodium chloride.
Just gonna add it with this one.
Facing towards the front.
gonna do my additive level as well. Mariam Adib. ID is 174963. Date of birth is 7th of 1st 69. Medication is morphine 50 mg divided by 50 mils, 1 mg per mils. Dilatant is 0.9% NaCl. Date is 20th of 3rd 17. Time is 10:16. Prepared by Deepa and checked by. Okay, thank you. Just gonna add that. And set my line as well. Too much.
Hi Miriam, I'm back.
Hi, how are you?
I'm good, I'm good. So I'm going to set everything up now, and I'll just have to get your full name and date of birth from you again.
Yep. It's Miriam Najib,
Yep.
7th of the 1st, 1969.
Yeah, that's right. 174963. That's right. And do you have any allergies, Miriam?
Not at all.
No worries. So, as I've said before, what you're getting is morphine. So it's a painkiller for moderate to severe pain, which is what you have. You said you got 8 out of 10. If you do feel sick in the tummy, please let us know. You also might feel a bit dizzy. Your slowing may, your breathing may slow, sorry. But that's is all expected, so I wouldn't panic too much. Just give us a buzz on the call buzzer, alright?
No.
Yeah. So it's that one. That's it.
I'm just going to look at the slide here.
Now we're just gonna go to the patient and then do our third drug check and second patient check as well.
Hasn't been in 24 hours.
Hi Miriam, I'm back with your medication, but before I give that to you, I just need to confirm your identity again. Would you mind telling me your full name, please?
Yeah, Adib Maniam,
Yeah, and your date of birth?
7th of 1st, 1969.
Yeah, and the MRN is 174963, 174916. And have you got any allergies, Miriam?
No.
Okay, that's better. So I've got your medication ready. You might feel a bit dizzy and nausea, but if you feel anything, you can just press the buzzer after the medication. So I'm just gonna do my third drug check as well. So I've got a patient named Mariam Adib, 7th of 1st, 1969. Oh, before I do that, I'm just gonna set my PCA line and then we can do it at the same time. Sorry.
Is that comfortable, Miriam?
There we go.
As I said, if you feel nauseous, dizzy, just let me know.
Yep.
So let me just explain this to you. So it's patient-controlled anesthesia.
Yep.
So what that means is that
Yes.
you're in control of giving yourself.
So, okay, 5 minutes. We're just gonna change the maximum
But
dose.
what we have said here is that you'll get 1 milligram
Lockout interval is 5 minutes. Maximum limit is 12, so we're just gonna make it 12.
Okay, there's also a 12 milligram hourly max dose, so you cannot get more than 12 milligrams per hour, okay? I'll give that to you. So it'll light up green, and then when you press it, it'll flash green. That means you're getting the medicine, and then it'll turn on.
Okay.
That means you are no longer allowed to.
So PCA dose lockout
After 5
interval.
minutes,
Next time. There we go.
Is there anything
Now
else?
I'm just gonna connect it.
Okay, well I'll get this started.
I'm just gonna grab some gloves.
Remember, no changing.
So I'm just gonna connect to your line. Gonna wipe it before I connect
Yeah, that's all
it.
good to go, Miriam. As I said, if you feel any pain, it's up to you when you press
it
And
for
can I
15
stress
seconds,
that no one else
so
presses
that-
it? It's completely up to you. Alright?
Okay.
No worries. See you later. Okay, so this is great.
Connect it to the line. Yep, and then secure it.
There we have the Thursday. Gonna put it up around 12:15.
There we go. Before I start, just gonna do my third drug check again. So it's a medication for Miriam Adib, date of birth 7th of 1st 1969, MRN 17496 and it's for her fractured ribs, morphine 50 mg per 50 mils. And it's a PCA dose, signed and printed by doctor. It's a PCA dose, so the dose is 50 mg morphine in 50 mils. Concentration 1 mg, syringe 3, PCA dose 1, lockout interval 5 minutes, vessel infusion 0 mg per hour. And the hourly dose limit is 12 mg. And doctor has signed it and it has not been given yet. So I've got my medication with me, so it was morphine sulfate. Morphine sulfate 5 ampules after the calculation. And so it's 10 mg per 2 mils, 10 mg per 2 mils, expired at 10:20. And we diluted with the 0.9% sodium chloride, 40 mils, and the expiry date is September 2018.
Yeah.
And I've got my medication ready here. So it's already set up. And for the final confirmation, it's a morphine. Concentration is 1 mg per mil. PCA dose is 1. Lockout interval is 5 minutes. Continuous loading, and the dose limit is 12 mg.
Okay.
So, do you agree with the
Yep.
medication? Thank you. Now I'm just gonna start the medication. So before I start, I would like to tell some information about this medication. So it's a PCA dose. So you will get the dose if you can press the green button here whenever you need the dose. But the thing is, you won't get it within 5 minutes. So it happens like in a 5 minutes interval. So I'm just gonna leave that to you. You can press the button now. So we just change the type. Okay, so you can press it now. So you've got 1 dose. So like that, if you need the dose, you can just press the green light whenever you need it within 5 minutes, after
Okay.
5 minutes. So if you need anything, just press the buzzer. But I'll be coming back within 15 minutes to check on you.
Okay, thank you.
Anyway, thanks. So I'm gonna wash my hand and gonna dispense everything. Dispense that as well. record there. So we gave the medication to Maria Madhu. So date is 20 after 17. Time is 10:26 and DA and the one. Can you sign that for me? Yep. Thank you so much.
Okay.
Well done. Thank you.